Welcome to Toolkit Talks, Joy and Work, Webinar 5. My name is Jennifer Smith, and I'm one of the outreach coordinators here with CoCares, which is the Colorado Alliance for Resilient and Equitable Systems, and we serve the healthcare and public health workforce. The Joy and Work Toolkit was created by the National Association of County and City Health Officials, or NACHO, using the Institute for Healthcare Improvements framework for improving joy and work. So like I said, today is webinar 5. It is the last of our videos. So we're going to do just a brief review here. So as you can see, we've gone through all of the steps except the last two. And the first two webinars that we had were actually pre-steps. They were kind of preparing you for having the conversation of what matters to you, working on communication skills and active listening, and then just preparing and looking at the toolkit and some of the concepts that we would find in that. And then you move on to the first step, which is asking staff what matters to you. And then the second step is identifying the unique impediments or barriers and challenges to the joy and work process. And so today we're going to be talking about steps 3 and 4. Number 3 is where you commit to a systems approach by to make joy and work a shared responsibility at all levels of the organization. So it goes through how to find those people and how to make it a shared responsibility and who's responsible for what. And then number 4 is using improvement science to test approaches to improving joy and work in your organization. So really, how are you going to test that the things that you're implementing, the changes and whatnot, making sure that they are working and providing the outcomes that you want. So kind of what we've learned so far is really about communication. So they talked about hearing is a sensory experience that gathers sound waves indiscriminately. We hear something without choosing to listen, background noise, just things that are going on. And then listening is the ability to accurately receive and interpret information messages in the communication process. So really just making sure that your communication skills are up to par and refreshing anything that you might need to before starting this process, because it really is about communication. And then active listening, how it shows the speaker that you are concerned. It helps you obtain better information. It encourages further communication. It has the potential to enhance relationships and create rapport. Can calm someone who is upset by using active listening. It invites others to listen as well, and it encourages better cooperation and problem solving. So really, I would definitely look up active listening, do some trainings or reading or watching some videos, and then, just to make sure that you really understand what active listening is. Then we have psychological safety. Of course, you can't have trust without psychological safety in this process. Finding joy in work will not happen if somebody is not feeling psychologically safe. So psychological safety really encourages respectful interactions from everyone. It does focus on equity. It invites participation. It uses direct, clear language. Make sure you're accessible and approachable. Set boundaries about acceptable and unacceptable behavior, and hold others accountable for boundary violations. That really shows that people, that you are trying to set some boundaries, you are trying to improve psychological safety, and then people will gain trust. And then we talked about equity versus equality. So equity as it relates to racial and social justice means meeting communities where they are and allocating resources and opportunities as needed to create equal outcomes for all community members. Equality means each individual or group of people is given the same resources and opportunities regardless of their circumstances. So making sure you are looking at through an equitable lens. The whole graphic of the people looking over the fence, they're both given an equal platform. So that is equality, but it's not taking into account the people that are shorter or can't quite see over that with the equal platform. You need to raise it depending on each person's situation. So those are just some things that we talked about already throughout the webinar series. If you missed any of the previous webinars, definitely go back and take a look at those, because you do need to build on this process, and it does involve the 4 steps and really committing to it. So the third step is where you're committing to a systems approach to making joy in work a shared responsibility at all levels of the organization. And so we talked about this a little in the beginning, and how the wheel, right, and who is responsible for what. So that's what we're going to go through today. So everyone from senior executive leaders to administrative staff has a role to play in creating effective systems, building teams, bolstering one's own resilience, supporting a positive culture, and then each person contributes to that. So it's vital to dedicate time and attention, skill development, and necessary resources for this process to work. And it's vital to have a constant champion dedicated to joy in work to ensure momentum and sustainability, right? This isn't a one-time thing. We're going to do this month and then we're going to forget about it. It's a constant process. So improving joy in work really equals using leadership skills at all levels. And they say you cannot just delegate responsibility for joy in work to the human resources department. It is everyone's job. So really, you're going to need someone in every level, right, of the organization or the facility or wherever you are to help out. Every level is going to contribute. And so this is, again, the wheel that we were talking about, the framework for joy in work. And this was created by the Institute for Healthcare Improvement. This is kind of the basis of the toolkit. So you can see that senior leaders are the outside of that wheel, and they are kind of responsible for everything, just kind of an overall, right? There's a few things in there that they're specifically responsible for. And then you can see the managers and core leaders are kind of responsible for 5 of the pieces of pie there. And then the individuals responsible for 3, right? So we have real-time measurement, wellness and resilience, daily improvement, camaraderie and teamwork, physical and psychological safety, meaning and purpose, autonomy and control, recognition and rewards, and participative management. So I think, too, when you look at this, you can see how and why certain people are responsible for certain things, right? There's only certain things that the senior leaders really have to take on and can only do themselves. And then there's the things, that the individuals really, those are the only things that they kind of have control in. They can have input on the other things, but really, I think the responsibility falls on the upper management for most of it, and then the managers and core leaders. So here we'll go through the basics. So senior leaders, right, they're responsible for all 9 components of the framework. They are responsible for that physical and psychological safety, the meaning and purpose, choice and autonomy, recognition and rewards, participative management, camaraderie and teamwork, daily improvement, wellness and resilience, real-time measurement. And then the managers and core leaders are responsible for 5 components of the framework, which are participative management, camaraderie and teamwork, daily improvement, wellness and resilience, and real-time measurement. And then the individuals are responsible for 3 components of the framework, which are daily improvement, wellness and resilience, real-time measurement. So here's some things they say to do in this concept of, the commitment to a team effort. Is you're going to need to list what the team identifies as bright spots and impediments or barriers and challenges. You're going to ask, what should we tackle first? Ask that all individuals participate in the local improvement work on some kind of level. Be specific about improvement. So example will be, we will develop our skills in improving this process starting tomorrow. Take immediate action with team members and ensure ongoing communication and follow through. Don't things that you don't want to do, or judge, accept, or deny ideas. Take it all on yourself. Ask them these things and then do nothing, of course, and allow large gaps of time to occur between the initial conversation and follow up conversations. So you want to make sure you really are getting back with people and the team about the conversations, and make sure you're scheduling these pretty close together. Even it's just, again, the follow up email or something like that. And then steps to try would be to engage others and support creative thinking through the sharing of ideas. You're really going to have the benefit here if you're talking to everyone and really talking and engaging with your team and with your people, because they're going to really have some great ideas. So you can use a short list of criteria to choose where to start. So sometimes it might be, you might feel really overwhelmed at starting these conversations, but just do a short list, right? So is there something we can do in our area right away? Is there an improvement that is a quick win? Something that is just, oh, we're going to cut out this process. Everybody agrees. Great. And it's going to make people's life just immediately better. Is this meaningful to several team members? So, if does everyone kind of feel the same way? Is this something that everyone agrees on? Maybe that's something we should start on right away. And our team members willing to test this change? It's going to take testing and trying the changes to see if they're really working. You or team members provide brief daily updates to the team. So this is a great idea. You could do just the start of a huddle, 5 minutes maybe, to just give an update. Maybe there was a change that was implemented and they can give a little update on how that went, even if it was just for 1 day or 2 days. So really, that's kind of the systems approach. I would print out, or at least look at, save it online, that wheel, the framework, and who's responsible for what. So you can kind of get used to how that's looking, and start discussing it with your team. And so now we're going to talk about the improvement science to test the approaches to improving joy in work in your organization. So one thing that IHI really does well and has a lot of information on their website, if you're interested, is all about the change and the model for improvement. So they really went into kind of more detail about how to test these improvements and test these changes. So they have a model for improvement, which is on their website. You can see the little graphic there that they have. And really just understanding that change can be difficult, but the aim is to make the change process rewarding and effective. And by using principles of improvement science, organizations can determine a few things. So one, they can determine if the changes they test are leading to improvement. And two, if they are effective in different programs, departments, and clinics. So again, if you're testing it in one area and you test it in other areas, it will show you if it's working in those other areas as well. And then three, it will show if they are sustainable. So are these changes a sustainable nature? And so this is just a graphic here. It shows the act, plan, do, study, do process. And it just kind of asks, what are we trying to accomplish? How will we know that a change is an improvement? What change can we make that will result in improvement? So those are some great questions, and just a great graphic, I think, to have up when you're in this process of testing your changes. So according to the Institute for Healthcare Improvement, the model for improvement asks those three questions. So I just went through those again, and just make sure you're constantly asking that, right? For every single change test that you're going to do, ask yourself those questions. What are we trying to accomplish? How will we know that a change is an improvement? And what change can we make that will result in improvement? So then their model, they talk about three things. They talk about setting aims. The aim should be time specific and measurable. It should also define the specific population of patients or other system that will be affected. So kind of like SMART goals a little bit, where you're that time specific and measurable. And then you want to establish measures. Teams use quantitative measures to determine if a specific change actually leads to an improvement. And then selecting changes. So ideas for change may come from those who work in the system or from the experience of others who have successfully improved. So tips for setting aims. So one, you're going to want to state the aim clearly. You're going to want to include numerical goals that require fundamental change to the system. You're going to set stretch goals, which is a goal to reach in a certain time frame. And you're going to want to avoid aim drift. So make sure as a team you do not deliberately back away or drift away from it unconsciously. Okay, so make sure you're really focused on the aim, the goal, right? And be prepared to refocus the aim. So possibly focusing on a certain area at a time, right? So maybe you made it a little too broad and you want to kind of focus it more on a specific area, which you didn't realize. And as you're doing these, of course, you'll get better and better at kind of making sure you're really focusing in. And then tips for effective measures. So you're going to want to plot data over time, data on length of stay, volume, patient satisfaction. So those are just things if you're doing changes that involve patient care or something like that, right? And these could be, again, you might be doing changes that are more internal focused, and some of this might not make sense for that. But I think when you're doing things as far as changes that could affect patients, then you probably want to make sure you're really collecting the data on that. And then you're going to want to seek usefulness and not perfection. So remember, measurement is not the goal, improvement is the goal. In order to move ahead to the next step, you need just enough data to know whether changes are leading to improvement. So it could be very easy to say, you get data on length of stay, right? If there's a hospital patient, or if you're in a facility somewhere that, you want to shorten their length of stay, and you're doing changes to decrease the length of stay for patients, you're going to know pretty quickly, right, if that's working or not, if that patient length of stay is decreasing. But again, we're not here just to measurement, we're here to improve. So what changes do you need to make if that's not working, if you're not seeing the data move anywhere? And you'll see that pretty quickly. And then use sampling. So sampling is a simple, efficient way to help a team understand how a system is performing. So you're going to integrate measurement into the daily routine. So you can develop a simple data collection form and make collecting the data part of someone's job. Often, a few simple measures will yield all the information that you need. So again, you're just going to integrate it, make it pretty simple. It shouldn't be difficult. It's really just for your improvement. So this is all you need to know is what you need to know. That's not going anywhere. You're not sending the data off. It's just for internal to say, is what we're doing, are these changes helping? And they're going to use qualitative and quantitative data. So qualitative data is easier to access and highly informative. You can ask patients and you can ask their families about the experience, right? Or internal, ask the staff, are these improvements working, right? That's qualitative data. The quantitative data is, again, the measurements, right? So what you're actually collecting on it. And so selecting changes. So ask, what change can we make that will result in improvement, right? What's the goal? What's the end goal here? And then what are the changes that will result in improvement, right? While all changes do not lead to improvement, all improvement requires change. And a note here on change concept. It's a general notion or approach to change that has been found to be useful in developing specific ideas for change that lead to improvement. So some examples of change concepts. For the elimination of waste, look for ways of eliminating any activity or resource in the organization that does not add value to an external customer. Improve workflow. Improving the flow of work and processes is an important way to improve the quality of the goods and services produced by those processes. Change the work environment. Changing the work environment itself can be a high leverage opportunity for making all other process changes more effective. Manage time. An organization can gain a competitive advantage by reducing the time to develop new products, waiting times for services, lead times for orders and deliveries, and cycle times for all functions in the organization. After generating ideas, you can run a plan, do, study, act, or PDSA cycle to test a change or group of changes on a small scale to see if they result in improvement. If they do, expand the tests and gradually incorporate larger and larger samples until you are confident that the changes should be adopted more widely. Once a team has set an aim, established its membership, and developed measures to determine whether a change leads to an improvement, the next step is to test a change in the real work setting. The PDSA cycle is shorthand for testing a change by planning it, trying it, observing the results, and acting on what is learned. So plan, do, study, act cycles. So step 1 is planning the test or observation and include a plan for collecting data. So you're going to state the objective of the test, make predictions about what will happen and why, develop a plan to test the change, who, what, when, where, what data need to be collected. Then your step 2 is to do, try out the test on a small scale, carry out the test, document problems and unexpected observations, and begin analysis of the data. Step 3 is study. Set aside time to analyze the data and study the results. Complete the analysis of the data. Compare the data to your predictions. Summarize and reflect on what was learned. Step 4 is to act. Refine the change based on what was learned from the test. Determine what modifications should be made, and prepare a plan for the next test. And then implementation. So implementing changes, it's the permanent change to the way work is done and involves building the change into the organization. So that will come after probably a few of the PDSA cycles. Once it's kind of, you don't have to make any more changes, it's working well, and then you can implement it into a permanent change. And now they do say this is where the change, right? The fear of change comes in because, yes, you may have to change documentation. You may have to update written policies, hiring practices, training, compensation, aspects of the organization's infrastructure that are not heavily engaged in the testing phase, right? So these are all the after effects of implementing a change. So you will have to make sure, what policy needs to be changed, what documentation, do we need to do anything when we train people or hire people? What else is this going to affect? And sometimes it will affect not much, maybe just a documentation of something or some kind of policy guidelines, but sometimes it may involve a little bit more change. And so that's kind of, I think, where the fear comes along, is changes that affect more things than just that one little area. Spreading change is the process of taking a successful implementation process and replicating that change or package of changes in other parts of the organization. So again, if you're testing this maybe just in one area with one team, it may involve more spreading that out into more areas and different teams. And it could be a little different during those two. So I would always say do the PDSA cycle in every area that it's going to affect, at least in each team. Like if you're doing this change in one area of the building or a group of people, try to do that in the others too, just to make sure what differences there might be. So that's really it for us. Again, you can find all the information for this on the NACCHO website and then also the Institute for Healthcare Improvement's website. They have more of the information on the testing processes, the PDSA cycle, how to, lots of videos on changing and implementing changes and things like that. So really, you just want to make sure that you're looking at all of this information in order of how it goes. Review it all before starting the process. I would say starting with those first videos and make sure you're really understanding everything before you get into this, finding the team and then testing your changes. Before you get into actually doing that, I would start with the first videos, 1 through 4. But yeah, so check out our website at cocares.org or co-cares.org. And our email here, if you need that, is CDPHE _ worker support at state.co.us. And you can scan the QR code to find our website with more information and all of our videos. And we really appreciate you watching today, and we hope you find that it was useful. Thank you so much and have a great day.